Hello everyone, thank you so much for joining us on this episode of our health discussion. On today's episode of our health discussion, we'll be looking at types of breast cancer. If you're joining us for the very first time, we really want to appreciate you. Thank you so much. Please stay with us because you will enjoy every bit of video we made here. If you have been here, may God bless you. Continue to be with us as well. So, breast cancer, like any other cancer, is actually a disgusting thing, something that we don't want it to happen to any person. If you can look at the pictures that you see, we have 1, 2, 3, 4, 5 pictures. These pictures are actually demonstrating how you can do self-examination at home. This self-examination is one of the best ways you can detect early breast cancer. So I really do encourage everyone, all ladies watching at the moment, please make sure you follow these steps and learn how you can do these breast examinations. Now, the very first type of breast cancer we are going to talk about today is the first you can see on the picture here. The first picture you can see, ductal carcinoma. So we are going to talk about ductal carcinoma as the very first type of breast cancer which you can have as a lady. If you look at the picture, the very first picture from your left, so we have 1, 2, 3, 4, 5, 6. So on the left part we have 3 pictures, and the right part we have 3 pictures as well. So we are counting from left down to right down. So we have 6 pictures, and each of these 6 pictures are the various types of breast cancer we are going to discuss today. So ductal carcinoma is the very first type of breast cancer, and this one has to do with ducts, okay, from the name ductal. So cells inside some of the ducts of your breast have started to actually turn into cancer cells. So you see the cells within the duct of your breast have started turning into types of cancer cells. So with this, you have what is called ductal carcinoma. And if you look at the picture, you look at the ring that is there, you see there is a small dot. That dot is indicating ductal carcinoma. This shows that it's something you will not be able to feel if actually maybe you have to do your self-examination. That is the more reason we encourage everyone else to make sure you always go for your breast cancer and cervical cancer check as well. Not only breast cancer, but cervical cancer as well. So ladies, please always try to go for your breast cancer, your cervical cancer. The next type of breast cancer we are going to look at is invasive ductal cancer. Now, if you are joining us the very first time, don't forget to hit that red subscribe button and you click notification. Yeah, you hit the red subscribe button as you can see here, and you make sure you click notification such that you will always see our videos. For those who have been here, please you help us share this video to friends, share it to family members such that they can also get this knowledge. Like I said earlier, make sure that you follow these steps and understand how you can do your self-breast examinations. You see, there are 1, 2, 3, 4, 5 different pictures here explaining how you should do this self-breast examination. The next type of breast cancer is actually invasive ductal cancer. Please, we are taking the next picture, which is from the left. So it's invasive ductal cancer. Invasive ductal cancer is the most common type of breast cancer. It therefore means that what? Most of the breast cancer that we have, so if you have 100 breast cancer, majority, more than 50% will be invasive ductal cancer. This therefore means that you need to pay more attention to this invasive ductal cancer because this is probably what you might have if you have breast cancer. If you look at the picture, you will see it painted in blue to indicate invasive ductal cancer. The next type of breast cancer is inflammatory. That's the next picture on your left. Inflammatory breast cancer is our next type of breast cancer. Inflammatory, just like if you look at it, you will see the picture of inflammation. You see the picture of inflammation denoted on the third photo you see here to show that this type of breast cancer is inflammatory breast cancer. Now, this cancer is rare, okay? It's a rare type of breast cancer. It therefore means that what? It is a cancer that you hardly find, but of course, it is out there, so you need to take note. The risk of breast cancer is something that we all need to take note about. Unfortunately, most of this risk is something that you cannot really control, okay? If you see something like genetics, you cannot control that, all right? Early menses, you cannot control that. Late menopause, you cannot control that. Family history, you cannot control that. Age, you can't control that. Gender, unfortunately, ladies are more prone. You can't control that. But things like breastfeeding, you can't control, so you need to breastfeed. Okay, if you don't breastfeed, smoking, alcoholism, all of that, you need to control it, because smoking and alcoholism, those are things that, especially smoking, because most of the cancer cases we have is because of smoking. Most of the cancer cases. In short, every 1 minute, 15 people die of tobacco smoking. Now, the next type of breast cancer, which we're going to look at, it is lobular carcinoma. Lobular carcinoma, that's the next picture, and which is the top picture on the right part of our photo. So, which is the fourth picture. So if you start counting from the left downward and you go up and start counting coming down, so we have the fourth picture, that is lobular carcinoma. Lobular carcinoma is our next picture, and this one has to do with the lobules. So it therefore means that inside some of your breast lobules have started having what? Becoming abnormal in terms of cancer. So you need to take special care about this. If you know you are just clicking on our video for the very first time on this channel, please do not forget to hit that red subscribe button and you click notification. Please do us this thing. Make sure you click the subscribe button and you click notification. For those who have been here, just share our video out to friends, share it to family members, because this video is going to help a lot of many ladies out there, so that they can know how they can take care of their breast and avoid breast cancer. Because like we said, some of these things we can do them at home, like the self-examination, so as to make sure that you don't have breast cancer that has stayed in you for a very long time. The next type of breast cancer we are going to look at it is invasive lobular breast cancer. So we are just from looking at lobular carcinoma. The next one is invasive lobular breast cancer, and this one has to do with what? This one has 10 to 15% of all breast cancer cases is because of this. So we need to take special note of this. Like we said, breastfeeding is a way of reducing your risk of breast cancer. So if you're a lady, take breastfeeding, very important, okay? This is going to help you reduce your risk of breast cancer. Make sure you breastfeed your child, because we know ladies nowadays, you might say no, you don't want to breastfeed, but it is also your right to decide on what to do. But we are saying that if you breastfeed, it is going to help you, it's going to reduce your risk of you actually having breast cancer. And breastfeeding also means that you need to breastfeed for a longer period of time. At least give a longer period of time. Don't just breastfeed maybe for 2 months and you win the child. So if you have been following this and you enjoy it, please consider subscribing to our channel and make sure that you actually hit the notification bell and you share this video, share it to friends, share it to family members, so that they can also enjoy. The last type of breast cancer we are going to talk about today is actually Buerger's disease. Buerger's disease is a rare disease that is associated with breast cancer. This is rare, and if you look at the picture 6 here, which is our last picture and our last type of breast cancer, you will see it on the nipples. So thank you so much. Please don't forget to subscribe to our channel. Thank you.